Medication administration. Nurses play an essential role in medication preparation and administration, medication teaching, and evaluating clients' responses to medications. Nurses evaluate the effects of medications on the client's health, teaching clients and their families about medications, side effects, adherence to the medication regimen, and evaluating the client's ability to self-medicate. It's important to know everything that you can about medications prior to administering medications. Regulations are made to protect clients. The first American law to regulate medications was the Pure Food and Drug Act of 1906. Federal medication law has extended and refined controls on medication sales and distribution, medical testing, naming, and labeling, and the regulation of controlled substances. State and local medication laws must conform to federal legislation. State laws control substances not regulated by the federal government. Local laws will regulate the use of alcohol and tobacco. Policies have been established to meet federal, state, and local regulations. A healthcare institution is concerned with preventing poor health outcomes resulting from medication use. The Nurse Practice Act is governed by individual states and helps guide the nurses through the regulations of medication administration. Most nurse practice acts are broad in their scope and nature, so they don't limit the nurse's functional ability. The primary purpose of the Nurse Practice Act, again, is to protect the public from unskilled, undereducated, and unlicensed personnel. Nurses are responsible for following legal provisions when administering controlled substances and narcotics, which are federally and state regulated. A controlled substance is defined as any medication that has the potential for abuse. Drugs can have three different names. The chemical name provides the exact description of the medication's composition. The generic name is the name the manufacturer who first develops the drug assigns to the drug itself, and then it's listed in the U.S. Pharmacopoeia. The trade name is also known as the brand or proprietary name, and this is the name under which a manufacturer will market the medication. An example of a well-known medication, the chemical name is N-acetyl-para-aminophenol. The generic name is acetaminophen, and the trade name is Tylenol or Panadol or Tempra. Drugs are classified according to their characteristics, their use on body systems, or their desired effects. Some medications can have more than one classification, such as aspirin, which can be an analgesic, an antipyretic, or an anti-inflammatory. It's necessary to understand pharmacokinetics when we're talking about medications in order to understand exactly how the medications are going to work on the body. Absorption, there's a different rate of absorption for each route of administration, and you need to be familiar with how quickly medications will be absorbed from these different routes. Topical administration has the slowest rate of absorption. The mucous membrane and respiratory tract have a quick rate. IV administration has the fastest absorption rate. The oral route takes some time because it has to go through the GI tract in order for it to begin working. When the site of administration contains a rich blood supply, the medication is absorbed quickly. Insulin injection sites that have been overused will develop what we call lipomas. And these are areas that now have poor absorption. Intramuscular sites will have a more rapid absorption than other injection sites, such as intradermal or subcutaneous. And you need to understand that fat absorbs very poorly. Safe medication administration requires knowledge of factors that alter or impair absorption of prescribed medications. Because some medications will interact with food, it's often appropriate to administer them before or after meals. Some medications with meals, and some medications on an empty stomach. The rate and extent of distribution will depend on the physical and chemical properties of the medication and the physiology of the client. Once the medication is entered into the bloodstream, it's carried throughout the tissues and organs of the body. The speed of distribution will depend on the vascularity of the various tissues and organs. In order to be distributed to an organ, a medication has to pass through the organ's tissues and biological membranes. Now, some of these membranes will serve as barriers to the passage of medication, so it'll keep it from passing throughout the body. For example, the blood-brain area will allow fat-soluble medications to pass into the brain and central or cerebral spinal fluid. Both fat-soluble and non-fat-soluble agents often cross the placenta and produce fetal abnormalities such as respiratory depression. And narcotic use can create withdrawal symptoms in the fetus. The degree to which medication binds to serum proteins will affect medication distribution. And most medications bind to albumin to some extent. Biotransformation can occur in the lungs, kidneys, blood, and intestines. If an organ is in failure or damaged, drugs that are normally excreted through it now can become very concentrated. If a client's kidneys are failing, for example, and they've been diabetic and they're on insulin, insulin is excreted through the kidneys, and since the kidneys are not working appropriately, the insulin will then be concentrated and will last in the system much longer than it does in a client whose kidneys are working appropriately. So in other words, toxicity can occur, and decreased dosages may be required to achieve the same effect. It's important to review the client's allergies and to be aware of medication cousins. Allergic reactions can be very life-threatening, or what we call anaphylaxis. Toxic effects can occur through impaired metabolism or excretion systems. So you need to be aware of the definitions of these types of medication actions. Medication interactions can occur when one increases or diminishes the way the other medication is absorbed, metabolized, or eliminated. On your medication profiles that you've been completing for Foundation Clinicals, one of the areas that you needed to complete was drug interactions. Be aware if a particular drug interacts with a particular classification. It will really help you administer medication safely. Also remember to question clients about over-the-counter medications. Their herbal and nutritional supplements should also be included, because these things can adversely interact with medications. Alcohol has a synergistic effect on antihistamines, antidepressants, barbiturates, and narcotics, since alcohol itself is a CNS depressant. But on the other side of the spectrum, a client that has high blood pressure might need to take a combination of medications, such as a diuretic and a vasodilator, to help control high blood pressure through the synergistic effect of the two medications. So sometimes we want that interaction, and other times it can be very harmful. After administration, a medication undergoes absorption, distribution, metabolism, and excretion. So again, knowing when and how these reactions occur will assist you when administering medications. Due to specific reactions, some medications may need to be evenly administered around the clock in order to achieve that maximum effect. Peak and trough levels might be ordered to ascertain the therapeutic levels and/or appropriate dosages of a drug. A trough is normally drawn 30 minutes prior to the administration of the drug. You should not administer the medication until you get that trough level back from the lab, because it may be elevated unless the physician has otherwise ordered it to be given. Peak levels are drawn when the medication concentration should be at its highest, which is usually 1 hour post-administration. In your book, Table 31.5 represents factors that influence administration routes. Each one of these routes are going to have administration pros and cons, and as a nurse, you can help the physician decide which route is going to be the most beneficial, giving the client's individual needs. The metric system is organized into units of 10. However, this system has to be used with great care, because if you move a decimal to the right or the left, it's going to greatly affect the dosage. That's why a 0 must always be placed prior to a decimal, such as 0.1, but never after a decimal. You have 1 milligram, it's not 1.0 milligrams. Household measurements are very familiar to most people. Medications ordered by this method will include drops, teaspoons, and tablespoons. And if you look in your book on Table 31.6, there's a lot of common conversions. Solutions are used for irrigations, injections, and infusions. A solution is defined as a given mass of solid substance dissolved in a known volume of fluid, or as a given volume of liquid that's dissolved in a known volume of another fluid. Make sure that you double check any calculations, especially with more harmful drugs or those that have more severe reactions if there is an improper dosage, such as insulin, heparin, and heparin drip rates. Some facilities have monitors or computers that help calculate drip dosages with the input of individualized client information, such as the client's weight, the dose that was ordered for that client, etc. You need to remember that tablets can only be halved, they cannot be quartered. With the smaller measurements, use a smaller measuring device if you want the best accuracy. Orders can be in many forms. They can be written, they can be computer generated, they can be oral, or they can be through the telephone. RNs are allowed to telephone a physician's medication order if it's a new one or a renewal prescription to the pharmacy, but there are some controlled substances that still require the handwritten prescription. For example, Percocet. The use of abbreviations when ordering medications is often the cause of medication errors. Only approved abbreviations are allowed to be used. And you need to refer to your specific healthcare facility for the list of approved medication or abbreviations for that facility. And additionally, the Joint Commission has a list of approved abbreviations. If you look at Table 31.7, a list of common statements, abbreviations used that lead to medication errors are listed along with recommended language. These are the types of orders that you may have in acute care agencies. When you administer medication, many healthcare providers are going to be taking a role in that medication administration. Each person has a pivotal part to ensure that the client's safety is maintained. The pharmacist is going to prepare and distribute prescribed medications. They often mix the IV solutions, and most medications are delivered in common forms and doses. The pharmacist works with other healthcare providers to provide information regarding medication side effects, toxicity, interactions, and incompatibilities. Medications are distributed in many formats, and you want to discuss the formats that are used by your personal healthcare facility. The most common medication administration systems include unit dose and automated medication dispensing systems. If there is no automated dispensing system, narcotics have to be controlled at shift change to make sure that the count remains accurate. The nurse's role in administering medications is as crucial as that of the physicians and the pharmacists. Nurses need to ensure that the right medication is ordered, that it's administered correctly, and that it's given on time. Understand that when you administer medication, you have a 30-minute window to administer the medication. You can give it 30 minutes before the due time and 30 minutes after the due time, and it will still be considered on time. There is a couple of types of medication errors. You have the omission error and the commission error. Medication errors can cause client harm. Errors include inaccurate prescribing or administration, or giving it through the wrong route or frequency. Documentation is required when an error is made. Remember, never transcribe orders with a trailing zero, and a zero has to be placed prior to a decimal point. Remember also to review client allergies with ordered medications to make sure that you don't commit a medication error in that sense. Again, the 6 rights of drug administration. Medication errors can be lessened when these rights are followed. If you observe all drug rights, you will rarely go wrong. When administering medications, it might be necessary to consult with other healthcare providers about administering medications. You gain experience as you learn to administer medications on a weekly basis or a daily basis. Medication administration requires both knowledge and psychomotor skills. The attitude nurses need to possess includes responsibility and accountability when administering medications to clients. If you do not know the medication, look it up. There is no shame in not knowing a medication. There's new medications being presented on a daily basis, and no one can be expected to know every medication. The American Nurses Association's Scope and Standards of Nursing Practice from 2004 addresses medication administration. The nursing process will set the framework for medication administration. During assessment, you want to find out about the client's history, their allergies, the medications that they normally take, what their diet history is, their current medical condition, as well as the client's understanding of any medications that they're taking currently. So, choose the appropriate nursing diagnosis from your NANDA list. Then plan client goals and outcomes. These need to be based on the client's condition and their current needs. Implementation includes promotion or maintenance of the client's health and factors to improve their health. Each acute care setting has specific regulations regarding medication administration. Each healthcare facility also has policies regarding transcribing and communicating orders, calculating dosages, and documenting medication administration. As a nursing student, you are never allowed to accept verbal or telephone orders. An appropriate physician's order is going to include the client's full name, the date and time the order is written, medication, dose, route, time, and frequency to be given, and a signature. So when you get ready to administer medication, make sure you check the MAR, or the Medication Administration Record. Retrieve the medication and compare it with the MAR. Take it to the client. Identify the client appropriately with at least 2 identifiers. Compare the medication with the MAR at the client's bedside. You never leave the medication unattended, and you remain with the client until the medication is administered. When you administer medications to infants and the elderly, special considerations are needed. Children often need medications in alternative forms such as liquids or elixirs. And oftentimes we need to realize that the elderly will practice polypharmacy, where they take 2 or more medications to treat the same illness. You have to evaluate the effectiveness of the nursing interventions when you assess whether the client has met goals or outcomes. Each one of these administration routes requires knowledge and psychomotor skills. With oral medications, we have to understand that yes, some of them can be crushed. Some of them can be given with food, such as pudding or ice cream or applesauce, to help the client swallow them. Some clients will swallow oral medications without any difficulty. But due to absorption, most medications given 30 minutes to 1 hour before or should be given 30 minutes to 1 hour prior to meals. Topical medications have to be labeled with initials, the date, and the time. You never cut a medication patch. Wipe off any residue with a tissue. If you put a new patch on, always look for an old patch and remove it. Fold the old patch to prevent medication transfer to your fingers. With the inhalation system, know your dosage. And with the inhalation system, they will get a better distribution of the medication into their lungs if they use a spacer. Appropriate education should be provided. And nasal inhalants, make sure that the opposite nary is closed prior to squirting the medication up the nose. There are some nasal inhalations that they get 1 squirt up one nostril on a daily basis, and you need to document which nostril is being used, and you'll use the opposite one the next day. With irrigation, you always use sterile water or saline or some type of antiseptic solution. With drops into the eyes, never touch the bottle to the eyelid or the eyelashes, etc. And do not use another client's eye drops on a different client. With eardrops, you can use a cotton ball. We encourage the client to lie with the medicated ear facing upward towards the ceiling for 2 to 3 minutes following administration. With rectal medications, make sure you always use lubricant. Insert it 4 inches into the adult and 2 inches into the child or the infant, inserting towards the umbilicus. Do not insert the medication into feces because it will just be expelled in the feces itself. You place the medication up against the rectal wall, and then encourage the client to lie still for approximately 5 minutes. With vaginal medications, again, use a lubricant, and then encourage the client to lie on her back for approximately 10 minutes. These are some additional special considerations with the children and the older adults. One of the most important things to remember with the older adults, if you have behavior changes, always suspect the medication. Calculating drip rates is another medication administration skill. You will calculate the drip rate in drips per minute. Divide the drip per minute rate by 2 or 4. The result should equal the number of drips falling in the drip chamber for 30 seconds if you divide by 2, or 15 seconds if you divide by 4, to obtain the appropriate drip rate. And you need to be aware of how to recognize and treat IV infiltrations. Infiltration of an IV solution will be the leakage of that fluid into the surrounding tissue. It may still be going into the blood vessel, but more of it is going into the tissue. These are the signs and symptoms. With the edema, you may also observe pitting edema. If you have redness, it is possible that you will observe pallor instead of redness. The site may be very cool to touch, and you may not see any blanching at the site. You have to stop the IV fluids immediately, remove the IV catheter, elevate the affected extremity, apply some cold compresses. Make sure that you restart a new IV site if the therapy is to continue, and of course you as an LPN cannot do that unless you're IV certified. But the new site should be preferably in the opposite arm that the infiltration is in, and it should be above the infiltration site. Depending on the extent of the infiltration, it can cause tissue damage and even necrosis depending on the medication. For example, dopamine, this infiltration can cause tissue necrosis. The site surrounding the infiltration can be injected with phentolamine or regitine to minimize tissue damage.